Welcome to JDRF No Limit Speaker Series event. My name is Shannon Dutton, and I'm a Regional Community Engagement Manager at JDRF. I'm delighted to have Dr. Katie McLean with us to talk about balancing mental health and T1D, especially that first year going into the holidays and all the emotions that come with it. I'm so pleased to introduce our featured speaker. Dr. McLean is a licensed psychologist health services provider in the state of North Carolina, specializing in pediatric and health psychology. Her clinical and research interests are focused on improving the lives of children, adolescents, and young adults facing chronic or life-threatening illnesses. Dr. McLean received her bachelor's degree in psychology and Spanish from the University of North Carolina at Chapel Hill. She then received her master's and doctoral degrees from the University of Miami in Miami, Florida. She completed her internship and postdoctoral fellowships at Rush University Medical Center in Chicago, Illinois. In 2019, Dr. McLean joined the faculty of the medical school at Atrium Health Wake Forest Baptist in Winston-Salem, North Carolina. Dr. McLean now resides in Durham, North Carolina with her family. She is passionate about her longtime work helping patients and families live with diabetes find their paths to flourishing with the disease. Dr. McLean, I'll turn it over to you.
Well, Shannon, thank you so much for that introduction, and thank you so much for having me. This is a topic that I am really passionate about. I love talking about how to adapt to living with type 1 diabetes and trying to find a balance where you're not necessarily you're not making decisions always based on the condition, but you are taking it into account. And I think the holiday season is a great time to start practicing those skills. So to make a quick disclosure, I have no financial or other disclosures related to the content of this talk. I do like to mention that this talk is not intended to replace advice from your healthcare providers. If you're concerned that you or your loved one may be experiencing significant mental health challenges, please reach out to your healthcare providers and let them know. So I want to start by getting us into the holiday mindset, thinking about the holiday season, what we imagine, what we hope for, what our culture sort of tells us to hope for when we're watching holiday movies or holiday TV shows or looking at holiday decorations in stores. A lot of times we're picturing this very calm, meaningful, pleasant time with our family and friends. We imagine a lot of times eating delicious food, maybe getting a little extra rest. There's all kinds of positive, enjoyable things that we really look forward to, that we hope for. And sometimes the picture that we have in our head is of this season that's very idyllic and beautiful, and something that we idealize a bit. So what's the reality? I think this slide, I enjoyed some of these pictures. They may be a little bit dramatic and they may resonate with you or not, but I do think it's worth mentioning that during the holiday season, sometimes family conflict can escalate, that we're with family members that maybe we haven't seen in a while. Maybe different topics get brought up that we have successfully avoided with our family members throughout the year. Travel is kind of a nightmare for everybody around the holiday season. I think whether you're driving or you're flying, it tends to be more difficult. And we sometimes have these ideas that our kids are going to have this really magical, special time. There's gift giving, and frequently, especially for younger kids, it can be a very overstimulating time. And so kids can have some emotional challenges as well as adults. So the reason I want to point this out is that frequently there can be a gap between our hopes for the holiday season and what the reality is, even when we don't factor diabetes into it. So even before we add the complication and the complexity of diabetes, we're already a little bit set up for having some expectations that might not be lived up to by the season. Something to note is that when there's a big gap between our hopes and reality, that can cause distress. And that's true for anything. So that when we have high hopes and then the reality doesn't meet those, that can tend to be frustrating and let people down. And I think that the first holiday season while living with type 1 diabetes can really be extra challenging, partially for this reason and partially for practical reasons for living with diabetes. But you're going into this season with memories of your previous holiday seasons where you weren't dealing with type 1 diabetes. And it can be hard to have some of those positive memories of stuff that you got to experience without dealing with the stress of type 1. Maybe you had plans for the current season that aren't going to work out the way that you had hoped because of type 1 or because of different challenges that you might be facing. And then, of course, you're going to be dealing with general worries about type 1 diabetes, not necessarily holiday specific, but the day to day management, making sure you have all your supplies, making sure you have your gear, all those things start to play into it as well. When we pull back a little bit and think about what you deal with when you're dealing with a new type 1 diabetes diagnosis in general, a new diagnosis brings up a huge range of feelings and emotions. And all of these are within the normal range. All of these are things that, as a psychologist, I would completely expect my patients and my clients to be talking about. So, grief, you're grieving the future that you imagined for yourself or for your child. Exhaustion, this is a nonstop, relentless condition that you have to deal with every day, no matter what. Maybe there's some relief. Maybe you were dealing with some symptoms, or your child was dealing with symptoms that felt unexplained. And now you have the relief of feeling like you have an explanation and you have a path forward and know what to do. Anger is very common, that it's okay to be angry and to say, I don't want this to be happening. And I'm angry that this is happening to me and my family. And denial, it may be hard to accept what's happening and this new reality. And really, the norm is to experience a lot of these feelings at once. And so I want you to just think for a moment, or even jot down, naming some of the emotions that you've experienced, whether you're a parent or caregiver, or whether you're the patient, and maybe other emotions that you feel like your family's been experiencing as you cope with this process. So we talked about all of these different challenging emotions that are totally normal, but a hard part of coping with and adjusting to a new diagnosis of type 1 diabetes. Let's throw the holidays in there. So what extra stressors can the holidays bring? Well, kind of like we mentioned and saw in that melodramatic picture, holidays can bring family complexity and conflict. There can be a lot when you're seeing family members you haven't seen in a while with a new chronic illness, that can be challenging. It also brings a focus on food and on eating, which, when you're adjusting to type 1 diabetes and some of the challenges around planning for food, managing your insulin, checking blood glucoses, it can make things more complicated and feel a little bit more stressful. Excuse me. There's also travel frequently. And you've got to now take into account, how am I going to manage my diabetes while I'm traveling? Your schedule's probably going to be disrupted. And sometimes there's financial stress added on top of that. Buying gifts, travel, those things can get expensive when you're also dealing with type 1 diabetes, and managing those costs, that can be extra stressful. So take a moment to think about what unique stressors the holidays bring for you and for your family. Oh, excuse me. Excuse me for one moment. Take a minute to think about those unique stressors and think about how these might impact you. A bit more coffee, I apologize. Sorry, Shannon. So, what do? We want to think ahead. So, I want you to think about starting to take into account your type 1 diabetes as part of your holiday preparation. This is part of your holiday planning. You're going to be planning trips, you're going to be planning meals, you're going to be thinking about what your family's going to do, adding diabetes into that planning. We don't want diabetes to totally dictate the season. You don't want it to be the thing that you know affects. Okay. So what do? Let's think ahead. So when you're thinking about the holidays, you're doing a lot of planning for holiday preparation, and you want to think of this as part of the planning. You're not going to let your diabetes completely dictate the decisions you're making, but it's going to become a factor in that decision making, the same way that where you live and where your extended family lives, those are factors. How much you want to spend is a factor. The diabetes is going to be a factor. But there's two approaches that I want to talk about today. So we're going to talk about multiple ways to engage in these different types of coping to help you plan and prepare for the holidays. The first group is what I think of as internal or individual coping. And those are coping strategies that you can use on your own, independently, privately, whenever you feel like it. You don't need to engage other people in it. And then the second way to coping strategies that we're going to talk about are what I think about ways to engage others in coping, or you could even think about it like external coping. But these are coping strategies that you would apply to your relationships and to try and recruit other people to support you as you move through and cope with your first holiday season with type 1 diabetes. So let's start talking about this internal or individual coping approaches. So I think the first really important thing to do is to check in with yourself. And what I mean by this is really reflecting on what are my own strengths and challenges right now as I'm coping with this new diagnosis of type 1 diabetes, whether it's for myself or for my child. And what are the things that are really the hardest for me right now? And something you can think about is, are there ways that you can care for those parts of yourself, the things that are feeling harder as you approach the holiday season? And we can think about this as trying to fill up your own gas tank, right? You're trying to make sure that you are taking care of yourself as you're going into a season where you may be expending more. And so the more you can try and build up that well-being emotionally before the holiday season, the better equipped you're going to be to handle challenges that might come up. So an example is, let's say you're listening to this and you're a young adult who was recently diagnosed with type 1 diabetes, and you're having a hard time maybe telling your peer group or your friends about your diagnosis, in part because you don't want them to treat you differently. Well, if you're getting together with family over the holidays, chances are you're going to have to talk about your new diagnosis a bit potentially. So maybe think about, would it feel comfortable to pick one or two friends that you who you trust, who you could share your diagnosis with and practice talking about that and get that support from them before you're thrown into an uncomfortable situation, with an aunt you haven't seen in forever. And that's just an example. That's something to think about. But on a personal level, there may be ways too just to improve your overall mood and well-being. So things like connecting with friends, engaging in pleasant activities, whatever that means for you. Getting outside, I know this time of year can be challenging depending on where you live, but getting outside as much as you can, getting as much sun as you can, and getting some exercise. I am a big fan of music and TV. I think if you choose that wisely, it can be a very great coping strategy. And think about what else you would add to your personal list. Maybe you enjoy making music. Maybe you enjoy writing down how you're feeling. Those are things to really try to make time to engage in, to care for yourself as you're going into this first holiday season. And then, sort of on the flip side, another thing you can practice is this concept of radical acceptance. And I think the reality is that the holiday season really may not look or feel the way that you hoped or wanted it to. You may have had high hopes. Maybe you had big plans that you just feel like you can't do anymore. Or maybe you have big plans that you can do, but it's going to have the extra level of stress of diabetes. Really try to push yourself to practice radical acceptance. And this is just the concept of, when you find yourself emotionally fighting against something that you can't change, really push yourself to say, this is how things are, not how I want them to be. I can't change it. And I'm just going to feel my feelings about it right now. And not trying to play the mental push pull of trying to change it in your head. And that can be hard. It sounds like a very simple concept, but I think when you're struggling with accepting a situation that's really challenging, it can be really hard. But you want to give yourself permission to feel the emotions as they come up, and don't pressure yourself to feel different. And this is, I think, a great skill for life in general, and especially helpful when you have when you're living with a chronic illness like type 1 diabetes. Practice both and. So this is just the idea that you can try and force yourself to remember that two conflicting things can be true at the same time. So you can be stressed about your new type 1 diabetes diagnosis, and you can be looking forward to a lot about the holidays. You can hold both of those things at the same time. Some of your family members may be unhelpful when discussing your type 1 diabetes diagnosis, and they still can love you and have the best intentions. Both of those things can be true. So maybe think about some both and situations that might come up for you during the holidays. And then this is one that I really try to practice in my own life too. It's this concept of looking for glimmers. And glimmers are small daily moments or events that bring you joy, peace, or contentment. So there's like it's a little moments. It's nothing big or major. They tend to be the opposite of triggers. So it's this idea of something that happens that elicits a positive emotional state, even if it's brief. And so keeping your eyes and mind open to these moments can increase the chances of you experiencing them, and they can increase overall well-being. So it's this idea of being present in the moment when you can, and noticing little things, whether it's, oh, the fall leaves look so pretty, or I just smelled some really good bread walking by that bakery. Those things sound small, but they actually can make a big difference when we notice them in our overall well-being. And something that might be helpful, I'm not, as a therapist, I'm not always a big fan of saying, look to the future, look to the future. But I do think it can be helpful in this particular moment when you are coping with your first season with type 1 diabetes. This is not going to be forever. So if this is a particularly challenging time, if this holiday season is really feeling off, this is only your first holiday season with type 1 diabetes. You have a lot more of these to come. You have the rest of your life to navigate how to manage a pleasant holiday season with your diabetes. Not all of them are going to feel like this. So really cut yourself and your family slack during this time that may be more challenging than usual. So just don't feel like you have to make the most of this one if that's not what feels right for you this year. So those were our internal coping strategies. Now let's think about ways to try and engage others in coping. So this is part of the planning idea, but you want to think strategically. So what are your plans as a family? What do they involve? Are you hosting? Are you traveling? Who are you visiting? Where are you staying? So whether you're the patient or you're helping care for a patient, you want to think a little bit about logistics for diabetes management. So finding a fridge, private space for injections, if that's what your your family member prefers, figure out what pharmacy you might need access to if you're traveling. Um, you could, I'm trying to think what else, like where you're going to keep supplies, those types of things. But try to identify any challenges and strengths also as far in advance as possible. So maybe you'll be staying with a family member who has a great private room for the person with diabetes to be able to manage it for themselves. Maybe though you're traveling to a place where there's not going to be much privacy, so you might want to help strategize with the patient about what's going to be most helpful for them. I also am giving everyone permission here to say no if you need to. And this goes along with the end of the last section of the individual coping, but that this won't be every year. Not every year is going to feel this way. And so think about the plans that you have and think about if they're the right fit for you and your family. And if this is the year to say no, that's okay. Give yourself permission. I've got a nice little script here if you want to steal it. We've talked as a family and decided that this year we're going to celebrate the holidays together at home. We'll miss seeing you, but we're excited to plan a visit at another time. You also don't have to use the type 1 diabetes diagnosis as the reason for saying no unless you want to. You really don't. It's up to your family about how you want to communicate that information. And I understand that sometimes this isn't an option. I understand there's situations where we have to travel, we have to see family. But I just want to give you and have you give yourself permission that if you have that option and it feels right for your family, this may not be a bad year to cut back on what you're doing and say no. So when you think about what you are saying yes to, though, when you decide what you're going to do, I really recommend you think about building like your family team. So who are you going to be seeing over the holidays? Who's going to be there both in person and potentially remotely? And who would be a good teammate for you and your family for the patient? So maybe there's cousins, maybe there's aunts and uncles, maybe there's grandparents, whoever you think is going to be supportive and helpful throughout the time that you're celebrating the holidays together. Get those people on board. So decide who they're going to be and reach out in advance with ideas for how they can support you and your family. So maybe you have a cousin who's really good at redirecting conversation. They'll be in charge of changing the subject if somebody starts to get judgy about food or if somebody makes a comment about what the person with diabetes is eating. Maybe a grandparent who's hosting can make sure a quiet space is ready for type 1 diabetes self-management and breaks for the person with diabetes to take breaks as needed. Think about what other ways your family can support you. Maybe there's specific things that you need or that your family member needs that would be really enjoyable to have. And make sure you talk to your team in advance and let them know how they can support you. Your family members are really going to appreciate, and the thing is, they want to help. They want to be there and be helpful for you. They're really going to appreciate knowing how to help you in concrete ways. And I know it can take effort on your part to think about that in advance. But if you can take a little bit of that effort in advance for yourself and your family, it may overall make whatever your travel or your visit is much smoother. Again, the flip side of this is to think about who are the people who might be challenging during this time and have those difficult conversations in advance. And I want to highlight that this is an adult job. And what I mean by that is that if you're the caregiver of a child patient with diabetes, this is your responsibility. Even if you are a young adult with diabetes, I think sometimes your parents, if we're talking about extended family members, I think your parents may actually be the right people to help you with this, depending on the situation. You have to talk to them. But we never want a child or a pediatric patient in charge of having difficult conversations with adults in their life. That's not appropriate. But I do think this is worth mentioning because this is another situation where sometimes setting some boundaries in advance might make your life a little bit easier. So, if you have a family member who you think may have trouble understanding or respecting boundaries set by the person with type 1 diabetes, having conversations in advance about the diagnosis and what is and isn't helpful should be considered. So, I think some examples of this might be explaining that comments about food or eating are not necessary nor helpful. I think that is something in general for people can be very, very triggering and difficult during the holidays. So, setting that boundary can be good. I think also limiting discussion of the diagnosis story that could be traumatic. A lot of people with type 1 have a very difficult initial diagnosis that can involve a scary hospitalization. This can bring up sometimes feelings of trauma. And so I think sometimes it's appropriate to say, we're not going to talk about that at the dinner table. Please don't bring that up unannounced. Um, During this conversation, sometimes clarifying differences between diabetes diagnoses. So I have been in situations where a well-meaning family member living with type 2 diabetes can become a little overbearing or trying to be supportive to someone with type 1, but has difficulty understanding the differences between the conditions. So having that conversation in advance may help the person, if they do have type 2, understand a little bit better why things may be different for the patient with type 1. And again, thinking of ways that can be helpful. We want to give people opportunities to support and we want to help guide them for that. We don't just want to tell them what not to do. But sometimes we do need to have some of these challenging conversations in advance. And this is another situation where we may need to practice our acceptance that despite your best efforts, you may have these conversations, you may prepare as much as you can, you may have to talk to this person about it again during the visit, or you may have to set a firmer boundary during the visit. But thinking about this in advance may make it easier to deal with when you get there. And I think on a more fun note, thinking about how to create new traditions for you and your family. Type 1 brings a new focus on food that can be stressful and frustrating. For some people it is, for some people it isn't. But I do think the holidays can bring a lot of pressure because it's so food focused in a lot of cultures that having a break from that type of focus and having to think about, well, what's my carb count and am I entering? Do I need to bolus? All those types of things. I think it can be nice to create traditions that don't focus on food, and it can be a way to shift focus for a bit. So check out local holiday events. Sometimes there's holiday markets. Sometimes there's different like train rides, and their parks departments do things. Take a holiday hike if there's a nice place to get outside and the weather cooperates. It can be really nice to get outside and enjoy the winter weather. Decorating, extra decorations, any last minute shopping. If you're with your family, maybe board game or video game tournaments, you can think of what your family enjoys. And it might be a fun thing to add to your holiday gatherings in the future, that if it really becomes a new tradition that you appreciate and enjoy. So, just in summary, the holiday season after your type 1 diabetes diagnosis may not look or feel the same as before, but with realistic expectations, planning, and support, it can be enjoyable and fun. Both individual or internal coping strategies and engaging others in your coping can be helpful during this period of adjustment. I just want to say thank you. Thank you so much for letting me share this. And I hope that some of this content's helpful and that you take it and adapt it to what works for you and your family, and that you really have a lovely holiday season as much as possible.
Thank you so much, Dr. McLean. We really appreciate you taking the time today to share some great tips and tricks to getting through the holidays with a newly diagnosed T1D. I personally love the message you shared about it being okay to say no. It's important to hear that, I think. I also found that planning ahead piece to be helpful at new diagnosis or 10 years in, like I am with my family. So thank you for sharing your expertise with us. We truly appreciate it. And we hope everyone has a happy, healthy, and safe holiday season. Take care.
Thank you.